everyone, and welcome to Wellness Matters. Men in general are less likely to schedule regular medical checkups compared to women, according to a recent survey. But what I found a little more surprising is that 70% of the men surveyed would rather do household chores than go to the doctor. Why is that, and what are the main health issues that men should look out for? Dr. Reinhold Zimmerman, who is a consultant urologist at the American Hospital in Dubai and the director of the Department of Urology, will explain it all. Dr. Zimmerman, great to have you with us tonight.
Hi, Maya. Good evening. Great to be here. Thank you very much.
I'm looking forward to tonight's episode.
Me too.
But before we start, let's tell the viewers a little bit more about you. So obviously you obtained your medical degree from the University of Munich in Germany, and you have over 24 years of experience in the field of urology. Dr. Zimmerman is a fellow of the German and European Boards of Urology and a member of the European Association of Urology and of the American Urological Association. He is currently also working on a project to introduce new applications of AI, artificial intelligence, for early prostate detection in cooperation with universities in the UAE and overseas. Dr. Zimmerman, welcome again. And before we start, also, I'd like to remind our viewers that they can post their questions in the live chat on both Facebook and YouTube. So I'd love to hear your questions tonight.
Me too, actually. Yeah.
I hope we get some. Don't be shy to put the questions forward. Let's start first with a quick round of 10 questions to get to know you and your views a bit more.
Sure.
So what are you most proud of in your career?
My animal research projects. They were difficult. It was about mini pigs and bladder injury, and they were actually very successful at the end.
Why did you choose urology as a specialty?
When I was a nursing student, at the first year I had to earn my own money. So I was working as a nursing assistant, I was assigned to urology, and I started liking it, that's it.
What is the misconception, the biggest misconception that men have about their health?
I'm functioning like an engine.
Okay. And at what age do you think men should start screening?
Depends, at the age of 45 or latest at the age of 50 if there is no specific family or personal history.
Now, do you think that men in their 20s and 30s should not get tested then, or go to a urologist?
They can come, but there is no way to do regular screening, actually. There is
no
reason
needs.
on earth.
Okay. What are your 3 top tips for men, and of course, when it comes to their health?
Don't be shy, don't be irrational, and don't be scared. Take yourself seriously.
What is the most common condition you treat?
Actually, it's most of the, many times it's prostate enlargement and all the symptoms about it.
How about the most difficult condition to treat?
It's difficult to tell, but actually really difficult is to treat urinary incontinence, involuntary loss of urine after a prostate operation. That's really tricky.
And does the age of the patient dictate which kind of treatment you...
Not really dictate, but it definitely tells us what kind of treatment options should be available or what should not be done.
And any quick words of wisdom for your patients?
Don't bother yourself if you have symptoms. Don't wait too long. Just come.
Okay. So Dr. Zimmerman, November just recently finished, and obviously November is the month for men's health awareness in the movement called Movember. So why do you think, as we mentioned in the beginning, that a lot of men delay going to the doctor?
It has many aspects, actually. Many men just don't take themselves seriously. They don't pay attention to signals of the body. And unlike women, they have the impression, we have the impression actually, we just have to function whatever it is. It has many, many aspects, and I hear it actually every day. And then, of course, you won't believe it, but they are shy and they are very scared usually. So they avoid to come because, and I hear it actually very often from my patients as well, Doctor, I have been waiting for this appointment for 6 months, but not because I was not available. No, because he did hesitate so many times to come, because he was so scared about what comes out in the examination. That's actually, it sounds funny, but it's a real reason. And it's apparently a real burden as well.
And usually the patients that come to see you are coming with symptoms, or do you see men that actually come for a checkup?
Yeah, actually, yes. Of course, we see many men who come for a checkup because, you know, in particular here in this part of the world, it's very common to come for health checkups because it's offered even by the employers, sometimes by the health insurances. Yes, we see men who come for checkups. We see men who come for just because they are worried, they have discovered something, or they have a friend who has something, and then they want to be checked as well. And then, of course, many men come as well if they have symptoms. And actually, many of them, I can tell you, come really late because of what I've told you before.
Yes.
Because when you observe something which could be wrong, then many of them just start thinking, start asking another doctor who is Dr. Google. And then they get more scared, and then they don't want to come at all.
I admit I'm Dr. Google at home, so I Google everything, and my husband is always following me not to do it.
So your husband is more clever.
Thank you. I'm sure he's going to like you tonight. So on an annual basis, what would a regular checkup for a man look like? What kind of tests should he do?
Okay. So usually these are the tests which are recommended if someone comes with or without symptoms. It's always actually the same. We just talk about the medical history, the personal medical history, as well as the family history. Family history is in particular important if it comes to prostate cancer. We'll talk about it later on.
Yes.
And then we have some standard evaluation tools like a standardized questionnaire, what the man has to fill himself. It's about 7 questions about the urination symptoms and difficulties what they might experience. Then if this is done, then there comes a physical examination. So the patient just lies down on the examination bed. This is actually why many men are so scared, because they still have in mind that there is this finger which has to go somewhere. But I can tell you that's not definitely needed nowadays anymore, because we have other tools, better tools. We have the blood tests, we have ultrasound, and some reasons we might have to do this. But if this is the only reason which keeps you away from the urologist, forget about it, just come. Okay. The physical examination takes a few minutes only. And then we usually do, on the spot, we do an ultrasound. It depends on the urologist. I always do an ultrasound on the spot, just to check the kidneys, the bladder, the prostate, and eventually anything else which is around. And then if there are any symptoms, then we can go further to more investigations, and usually we do a uroflow, which is just a normal urination. You have to have a full bladder, then you just urinate in a specific toilet, and some parameters will be recorded, and this gives us a very good impression, actually, what kind of trouble you have if it comes to urination. So if the urinary flow is too weak, if you retain urine in the bladder after urination, and all these kind of things. So everything just takes maybe 10 minutes or 10-15 minutes, and then you're done. And of course, at the end, usually if you have reached the screening age for prostate cancer, then we do a blood test, which is called PSA, prostate-specific antigen, which is, it's a kind of a prostate screening. It's not really a good screening for prostate cancer, but we don't have any better one at the time being. It's more a marker, a biomarker for the prostate rather than for prostate cancer, because it can be elevated for many reasons. And that's what we are doing as a routine.
Okay, so basically a lot of the tests are really not invasive at all.
No, there is no invasive test at the beginning, no.
Okay. Now we have actually a question about prostate cancer on social media, but I think we'll hold off a little bit to answer this question, because we have a section on prostate cancer coming up in a bit, and I'll ask you that question when we come to it.
As you want.
But before we start, let's explain what the prostate is and where the prostate is.
Let's
because
try
obviously
to do
it's
it like
a gland.
this. Yeah, please go ahead.
No. I'm going to let you explain what the prostate is. But
so maybe,
okay, I'll hold the iPad for you.
Hope it will be visible on the screen without too much reflection.
So this is the prostate.
Yes, how do you know that?
I'm smart.
I know you are. So that's the prostate, actually. Just to give you an idea where the prostate is located. So that's the urinary bladder. So the prostate is just located below the urinary bladder. Okay. The channel for the urination, which is called urethra, is traveling through the prostate. All right, maybe like this.
Yes.
Okay. Okay, and what you cannot see here, what you can see here, there's the pelvic floor. And the pelvic floor contains a very important organ here, which is called the sphincter muscle. This is the muscle which makes you actually able to hold the urine on. So you can imagine when we are talking about prostate operations, this is a very, very important structure because it should not be damaged. And around the prostate, this image doesn't show, but around the prostate there are very many blood vessels and nerves. And two extremely important nerves are traveling on the right and left side of the prostate. These are the nerves which are in charge for the erection. Also important if it comes to operations of the prostate. So you can see the prostate is located in a strategically very important and also difficult, tricky position in the body.
Mm-hmm. Now, one of the most common problems is prostatitis, which is the inflammation of the prostate gland, and this is the prostate gland that we were talking about. So this is usually the problem that is most common in men below 50, correct?
That's kind of correct, but
Okay.
we have to specify it a little bit further. So prostatitis would mean there is a bacterial infection. And I mean, the symptoms are pretty similar. Either you have a bacterial infection or you have a prostatitis which is called abacterial inflammation or infection, which means there is no bacteria. So around 90% of all people who have these prostatitis symptoms do not have a bacterial infection. Why it is so important? Because the treatment is fundamentally different. So it's the misconception, whenever you have those symptoms, you just take antibiotics.
But what are the symptoms?
Yeah, exactly. I just wanted to tell you. Can be pain, discomfort around the prostate. We call it in the perineum. This is just below the scrotum, actually. Difficulties to urinate. It can mimic actually the same kind of symptoms what you're having if the prostate is enlarged. So hesitancy to urinate, a weaker urinary flow, burning sensation. Pain is a very important symptom, actually. Pain everywhere around this area, in the perineum, in the scrotum, around the balls. Even back pain can come from a prostate problem. And then we just have to know, is it a bacteria which causes the problem, or is it a non-bacterial prostatitis? And then the treatment has to be defined.
Would that be a blood test? How would you diagnose it?
No, it's actually a urine test where you can find out if there is a bacteria, and then it's a seminal fluid which has to be cultured as well. And then you will know. Is it an infection? If the fluid doesn't show any bacteria, then it's not an infection. Symptoms might be the same, but the treatment is different.
Now, what are the main causes that would cause this condition?
Well, in many cases, we are not able to find out. 90% of all people who have this prostate issues in a younger age do have no bacteria. So if it is a bacterial prostatitis, then it was a previous urinary tract infection most of the time. If it is this abacterial prostatitis, which is around 90% of the cases who have this one, then we hardly are able to find it out, actually. It can be sometimes honestly psychological. Other times it was a previous infection which has not been completely cured, and then it led to inflammation. Inflammation is not the same as infection. And then the prostate is just somehow affected, and it causes the pain. Because remember what I've told you before, the prostate is surrounded by many nerves. And of course, as long as an organ has many nerves around, and the organ itself isn't doing well, then of course you will feel it, because the nerves give signals.
So now, as you mentioned, we have the bacterial and we have the non-bacterial. So let's start with the non-bacterial. What would treatment involve?
That's actually the more difficult one. Since many times we don't really know what the root cause is, the treatment is difficult accordingly as well. So it comes sometimes you just need to tell the patient what it is and to relax. And as long as he knows that there is nothing serious, he will just be better able to deal with it. Other times we give mild anti-inflammatory for a longer period of time. There are some herbal medications as well, which can actually help. But then you are talking about a treatment period of maybe a couple of months. Or you can actually take real prostate medication as well. And if it really comes to more pain or more discomfort, then you can, for instance, you can do something which sounds maybe weird. It's a low energy shockwave treatment on the perineum, which can relieve pain. This was one of my research projects, what I did before, and it was really interesting that this works. So there are many options, and usually it's a combination out of different kind of treatments.
So is it psychological to a big extent then?
It's kind of, it hits many people actually who have stress. This is kind of a psychosomatic, or can be a kind of a psychosomatic disease, like the chronic bladder pain, like the irritable bowel syndrome. So it's all kind of the same. If you're not doing well for whatsoever reason, then these organs can be affected.
Now, bacterial is obviously easier to treat because
Exactly.
you can give antibiotics, I would assume.
That's it. Exactly.
Okay.
You just give antibiotics for a certain period of time. It has to be for a longer period of time. Usually we're talking about at least 4 weeks. Why so long? Because the blood supply in the prostate is quite low, so it takes quite a while to reach a sufficient antibiotic levels in the prostate. That's why.
Now, in the beginning, you said one of the most common conditions is the prostate enlargement, or BPH. So this usually occurs in older men rather than younger men.
Correct. Yeah.
And so, can you start by explaining the condition and its symptoms?
Okay. I mean, it's normal actually for every one of us that the prostate starts growing at a certain age. It comes from some hormonal imbalances, which are just happening because we're getting older and older, and of course, this comes with some alterations in the body. So, the prostate usually starts growing in the middle. We call it the central zone of the prostate, which is unfortunately just around the urethra. Remember, I told you before, the prostate, I mean the urethra, the pipe, the channel for the urination is traveling through the prostate. You can't see it here on the picture, but it's actually in the middle of the prostate. So you can, and this is the part of the prostate as well, where the BPH, the benign prostate hyperplasia, starts happening, the central zone. And if the prostate starts growing around the urethra, you can easily imagine it could eventually cause kind of a blockage of the urethra, because the prostate is getting bigger there, and it compresses, it makes the channel just tighter. So that means you might experience some difficulties to urinate at the beginning. So the people just feel they are taking longer in the bathroom than the other guys. But they have to go more often, because the bladder has to work harder actually to squeeze the urine out. The flow becomes weaker over the time, and then if it becomes a little bit more serious, then you're not able anymore to completely evacuate the urine, because the obstruction just becomes more and more. And then you feel you have to get up at night, for instance, often, and you feel it more and more difficult, harder to urinate, and you feel the bladder is always full, although you have been at the bathroom just 10 minutes ago.
Such an annoying feeling.
Yeah, I guess it must be annoying. I hear it from my patients. Thanks God I don't have personal experience.
Thank God. So how do you diagnose it?
Remember what I've told you before. It's just
it's basically the same, more or less, for all the conditions.
Exactly. What I did mention before, when we do the basic evaluation in the office, we do ultrasound. So then we can see, we can measure the size of the prostate. However, this is a little bit misleading, because the size of the prostate does not directly correlate with the severity of the symptoms. So I like this story to tell. I had a patient, a young guy, 53 years old. His prostate was only 28 milliliters. Small. 28 it's a normal size of the prostate, actually. He had 3 episodes of urinary retention. He couldn't urinate at all anymore. He needed a catheter.
Wow.
And then finally, we had to do the operation because the prostate was, although small, was totally obstructing, blocking the urethra.
Oh.
Another patient of mine had a prostate which was 140 milliliters in size. All right, and he still could urinate fairly well. So this gives you an impression. So the size of the prostate doesn't tell us much, actually. It just gives us an idea.
Would it be more the location compared to the
flow, the urinary flow, actually? So this flow test, what we are doing, tells us much more, because the most important parameters are how strong or weak is the urinary flow, and this is all done at the time of the first visit in the office, actually, and how much urine do you retain in the bladder after urination. So these are the really important parameters. Why? Because at the end of the day, we don't care too much about the prostate, actually. But what we have to do whenever somebody gets problems with the prostate, we have to preserve the bladder function. That's the really important thing, because the prostate is just maybe a disturbing or annoying organ which causes a problem for another organ, which is much more important, which is the urinary bladder. The problem is, and that's why I emphasized before so much, don't wait too long. If the bladder has to work very hard for a long time because you have just ignored the symptoms, then the bladder will be able to compensate it for quite a long time. So the bladder is just a big muscle. So the muscle is getting stronger and stronger for a while, like a bodybuilder. You build up the muscles. But one day, the bladder will not be able to compensate anymore. It will decompensate. And then you end up in a urinary retention. And these can lead, actually, over the time, over many years, of course, it doesn't happen from one day to the other, can lead to severe damage of the bladder. And these damages are irreversible. So there is no medication, there is no operation to restore the bladder once it has reached this stage. And that's why it's so important to take care of it.
That would include not being able to hold your urine anymore?
No, not at all. That would include not being able anymore to evacuate the urine.
Ah, it would be the opposite, okay.
Exactly. You would always have a full bladder, which is, of course, at the end of the day, even harmful for the kidneys.
Yes.
This is actually the reason from what many men 100, 200 years ago died. They died from kidney failure because of prostate enlargement.
Oh.
Because there was no way to fix it at this time. And the prostate just got bigger and bigger. That's what I've told you before. They couldn't urinate anymore, and there was no way to open up the prostate. And it was actually, bladder got fuller and fuller because they were not able anymore to evacuate the urine. And then a reflux of the urine from the bladder into the kidney started. And if this carries on for a longer period of time, then the kidney will be severely damaged as well, and then you end up in kidney failure. Thanks God this doesn't happen nowadays anymore because of all the diagnostic tools what we are having. But this was actually one of the main reasons why old people died in the old ages, actually.
It's because
120 years ago. Because of kidney failure.
And because of the infection it causes, right?
It can be infection, exactly, but it's just a chronic urinary retention, which then affects on a retrograde way the kidneys as well.
Okay, if we diagnose this before it's too late, what are the best treatments for prostate enlargement?
So don't get scared again, because this scenario doesn't happen anymore nowadays. Yeah.
I'm happy to hear that. Yeah. I'm sure all the men who are watching us would be happy too.
I hope so. Yeah, I mean, there are many different ways to treat the prostate. At the beginning, if it's just mild symptoms, your uroflow might not be perfect anymore. You can just start taking herbal supplements for a while, and we continue checking it. You come for regular follow-up, etc., and then we will know when you reach the next stage, when you need to take, let's say, real prostate medication. There are two classic medications for prostate issues. The one is it's called an alpha blocker. It just relaxes the muscles around the urethra, around the channel for the urination, and it relaxes the bladder neck as well. So that means it just makes it easier to evacuate the urine. So this is a medication which you have to take once a day. The side effects are not that huge, and this is usually a chronic treatment. There is another medication which can be added as needed, which makes the prostate physically shrink of maybe 20-30%. This makes sense in particular if the prostate has reached a certain size, let's say 40, 50 milliliters and above. Then you can actually combine these two medications together, and you follow up and see how long it works. And of course, one day it might happen that the medication is just exhausted, so you take the medication and still the uroflow is getting weaker and weaker. And then of course we have to talk about some procedures. To fix the problem, and this is what most of the men don't want to hear at all.
We don't want to scare them, but we want to inform them.
Exactly. So, and actually there are so many options, and nowadays, this is what I can tell you, the treatment for this issue for the BPH, benign prostate hyperplasia, is customized. So it depends on the age of the patient, it depends on what he wants. It depends on the size of the prostate, so many factors. So what you need is actually, first, you as a urologist, you need to inform the patient about everything, because he wants to know. Our patients are super educated. They know everything. So I have to be the advisor. And then, of course, the patient has to tell me what he wants, because sometimes, he tells me, definitely, I don't want to lose my ejaculation, for instance. Then
yes, I think that's the problem, that men are scared to lose like this.
Exactly, but there are options nowadays which can preserve the ejaculation, even though the prostate might have to be operated. But you can preserve it. So that means you need to go to a place where all these options are available. And then you can kind of choose let's say within some limitations.
There's actually a question on Facebook that's very interesting. Is there a new procedure to reduce the prostate size and open the urinary canal by using suturing instead of surgery?
Okay, there is someone who knows very well. Yeah, this procedure is actually, it's called Eurolift. And this is exactly what it is. You go inside. This is a minimally invasive procedure. It's not an operation. It can be done even in an outpatient setting, actually. And then you just put some kind of small hooks in the left and right prostate lobe, because when the prostate blocks the urethra, it just closes the urethra completely. The prostate has a right and a left lobe. And with this procedure, you just put some small hooks and open the prostate like you open a curtain. And then the urinary flow will improve.
Okay.
So this is actually, which is something very good. It's minimally invasive. It doesn't work for everyone. So there are some limitations. So it's not for everybody. The size of the prostate is a limitation, and of course other factors as well. But in general, that's a very clever procedure, at least for a while. It will not fix it forever, but it's, let's say, a temporary solution. You buy time with it.
But it sounds good to me. I mean, I'm sure it's going to sound good
I have done
to people
it
suffering from
many
that.
times
Yes.
in my previous place, and now we have it here as well. So it's called Urolift, and it's really good. If you are eligible for it. It's not for everyone.
Okay. Now moving on to prostate cancer, because I think a lot of men are worried as they age about prostate cancer, and I think it's the thing they think that's most likely to happen to them, possibly with age. So let's first try to explain how can you diagnose prostate cancer? Is it also via blood tests and not just the regular testing that happens for normal prostate?
Yeah, this is what I've mentioned before. Usually you're recommended to go for the blood test for this PSA at the age of 45, if there is a family history of prostate cancer, otherwise at the age of 50. It's a blood test which should be done once a year. And I mentioned before, the PSA is not a perfect prostate cancer screening. Actually, it's more a prostate screening. It's more a biomarker for the prostate rather than for prostate cancer. However, if it is elevated, then it tells us there is maybe something not okay with the prostate. And nowadays we have a very, very good tool if it comes to further investigation of the prostate. So if it is needed to investigate the prostate further, then we just follow our standard, which is nowadays considered to be the gold standard. And it's called multiparametric MRI of the prostate. An MRI is magnetic resonance imaging. It's a particular imaging modality. And this follows a certain protocol. It's standardized, actually, internationally standardized. And this MRI is actually able to find very small spots of suspicious areas in the prostate. And then you can tell, according to the reading of the MRI, regardless of the PSA level, if there is a problem or if there is a suspicion of a prostate cancer or not. And then if this is the case and the MRI shows us something, then you have to move on and you have to something which is called a prostate biopsy. You take a tissue sample from this area. And nowadays you can do it in a targeted way. So that means the MRI will guide you where you have to take the biopsy from, where you have to take the tissue sample from. So this is nowadays the gold standard.
Now, one of our viewers is actually asking, what are the most alarming first signs of prostate cancer?
Okay, that's a very, very important question. We really have to focus on this. Nowadays, there are no symptoms of prostate cancer. Why do I say nowadays? Because, you know, in the old days, the people became to know because they really had symptoms like blood in the urine, etc. Again, difficulties to urinate and all these kind of things. It doesn't happen nowadays anymore because this did only happen if the prostate cancer has reached a certain size. We don't see this nowadays anymore, thanks God, in almost no cases. So because the prostate cancer nowadays is discovered in a very early stage usually. So nowadays there are no symptoms of prostate cancer because almost everyone goes regularly for the checkups and you would do all the tests what we have talked about. And so you would be able to find it out. So whatever symptoms you have, there is a very, very high likelihood that this would never be related to prostate cancer. That's why the screening becomes important. Screening for prostate cancer has been very, very heavily debated for the last 20 years. But still, what we can say, at least screening enables us to discover almost every prostate cancer in a very early stage, which means in a curable stage.
I hope the men watching us are more encouraged to go for screenings, so that early detection obviously improves the prognosis as well. So for prostate cancer specifically.
This is it. Yeah, exactly. This is it. So for instance, the number of advanced prostate cancers has dropped since we have introduced the screening.
Now we also have one more question about the Eurolift you just spoke about on Instagram. And so how long would it take a Eurolift therapy to fix the BPH?
I mean, this is about the procedure duration, and the procedure usually takes 15 to 30 minutes maximum.
But how long after it would you maybe be able to...
Okay.
How would it cure the BPH?
As I said before, it's temporary.
Temporary.
It's temporary. You can, I mean, it depends on many facts actually, but usually you could guess it would be a couple of years. So that's why I said before, you're buying time.
Okay.
Before you need to move on and do a more definite treatment.
All right. So one more question about prostate cancer before we end. When you customize treatment for your patient, how is that treatment customized based on the diagnosis?
Okay, that's a very, very important question. See, if there is a prostate cancer, then it depends on many facts actually, what kind of treatment has to be done or can be done. If you take a tissue sample from the prostate, then this sample will tell us a lot about the aggressiveness and about the volume of the prostate cancer, which of course then defines the treatment. So thanks God, in most of the cases, we find the prostate cancer in a very early stage. And sometimes the aggressiveness is so low, it comes with a specific reading, which is called the Gleason score. If this Gleason score is low, then sometimes you don't need to do any kind of treatment, but you just do something which is called active surveillance. You just follow the PSA up. You have to repeat the MRI, let's say every 1 year, and you might have to repeat the prostate biopsy, and those men do not require any kind of treatment, but you have to make sure by the active surveillance that the aggressiveness doesn't become more. So many men actually do not require any treatment. And of course the age makes a difference as well, because if you are older, then the likelihood of a high aggressive cancer is less. And many men actually just die with, but not from the prostate cancer. And this has to be taken into consideration as well. And then if it comes to treatment, then there are many options nowadays. Of course, it's many men just say, okay, I have a cancer, I just want to get rid of it. And they are classical candidates for an operation, what we call radical prostatectomy. And ideally, this is nowadays done robotically. This is what we have available, for instance, as well here in American hospitals. So why robotically? It's not that the robot would just be a fancy tool, but it's very important. Remember what I've told you before. The prostate sits in a strategically very important position. So that means you have to remove everything in order to be cancer-free, but you shouldn't remove too much. That's why the robot comes into the game.
And that's where your research on AI is based, or no?
This has a different reason. Actually, this is more about improvement of early detection, improvement of the accuracy of the MRI, because right now we depend on the radiologists who are reading the MRI.
Correct.
The goal is let the machine read it, because the machine will be much more accurate, will be much more precise, and the machine will never be tired. So that's a very interesting project, actually.
But some people might counter-argue and say maybe the machine might glitch, especially in the early stages of maybe, I don't know. What do you think?
That's why all these projects are always like this. Of course, still we carry on with the traditional way the radiologist reads it, and we just feed the computer with data of conventional MRI reading, with data of prostate biopsy, and with MRI images. And the machine will learn by the time. And one day the machine will be much better, actually.
I think AI is going to be the future in healthcare, not just when it comes to
definitely,
urology.
you have to look at it a little bit carefully, because it's big hype as well, but definitely AI will be very, very important for the future of healthcare. You just have to focus on the right topics, actually. But definitely it will help us a lot to be more accurate and specific in terms of diagnostic, and to be even better in terms of treatment. Because this is one of the options what we have for prostate cancer as well. Now we know where it is because the MRI has told us where the focus is. Then we take the sample out of it, we confirm it, we make kind of a land map of the prostate. And then, okay, some men might go for radical prostatectomy, other men might want to go for radiotherapy, which we have available here in American Hospital as well, very advanced facility by the way. Radiotherapy means just you do radiation, you kind of burn the prostate tissue, and of course you kill the prostate cancer as well. A different option. And there is focal treatment as well. Okay. We just focus on the focus.
Okay.
And we know where it is.
Interesting. Now we have one more Facebook question regarding prostate cancer. What's the rate of getting cured from prostate cancer?
Okay.
Even though you just mentioned that some of them live with prostate cancer and don't die of prostate cancer.
Almost, I mean, the big majority of men do not die from prostate cancer nowadays anymore. So, as per the statistics, for instance, of the American Association of Urology, around more than 80% of prostate cancer cases nowadays are discovered in an early stage. And all of them can be cured. So this is what I'm always telling my patients. Don't worry. It might be prostate cancer, of course, it's better not to have it. But it will not affect your life expectancy because it can be cured. And it will, as long as we carefully choose the right treatment, it will also not affect your quality of life, which is another very important aspect.
Yes, definitely. Dr. Zimmerman, it was really such an enjoyable discussion this evening with you. The time just flew, but we have to end, unfortunately. And I think you'll join me in urging all our male viewers to take better care of their health, especially with the new year coming up. So maybe it can be a New Year's resolution. And for our female viewers, I think you can continue to nudge the men in your life in the right direction, even though they can be quite stubborn at times.
I don't want to hear this.
Well, I speak from experience.
Oh, okay, I got you.
And I'm sure so many other women will agree with me. Anyway, before you go, remember to like and share this episode on Facebook and to subscribe to the American Hospital's YouTube channel. And join us next Tuesday at 8:30 p.m. with Dr. Bissam Ismail, who is a consultant oncoplastic and reconstructive breast and general surgeon. And we are going to discuss everything there is to know about breast reconstruction. We look forward to seeing you and have a good night.
Thank you very much. Have a good night as well. And thank you for joining us.